The overall goal of this procedure is to develop a technique whereby tumor treating fields, or TTFields, are applied concurrently with Bevacizumab for the treatment of recurrent glioblastoma. This is accomplished by first using MRI data to generate a treatment layout. Next, TTF system components are assembled and transducer arrays are applied to the scalp. Then, the TTFields are applied according to the treatment layout. Finally, Bevacizumab is administered in a standard fashion. Ultimately, a follow-up MRI of the brain with gadolinium DTPA is obtained in order to assess tumor response to this novel therapy.
Though this method can provide insight into the treatment-resistant gliomas, it can also be applied, in theory, to other tumors, such as brain metastases, although currently the only FDA-approved indication for TTFields is for recurrent glioblastomas.
Generally, healthcare providers new to this method will struggle because of the lack of familiarity with the TTF system and its proper operation. They will therefore need special mandated certification provided by the manufacturer.
The TTF system is composed of the following instruments: a portable battery, a connection cable and box, an electric field generator, a plug-in power supply, and a set of transducer arrays. To assemble the TTF system, charge the